Hello, everyone. I'm Rick Martin, Director of Communications and Community Relations for Douglas County and the Public Information Officer for the Fire Department, with a special interview with the District Director of Cobb and Douglas Public Health, Dr. Janet Memark. Dr. Memark, it's Wednesday, December 16th. COVID numbers are still rising. What are the current numbers in Douglas County, and what is the status of WellStar Douglas?
Yeah, so I wish I had better news for us, but we continue to surge on in the number of cases. And so currently we have 5,769 cases and 95 deaths in Douglas County. That does not include the number of antigens. So remember, this is the traditional PCR testing that we're doing. When you put in the antigen test as well, we're over 728 cases per 100,000. So those who may remember that 100 cases per 100,000 is considered substantial high transmission. So we are way past that. And so we have some very, very efficient community transmission that is happening right now in our community. And then the hospitals are very, very full. Across the metro, we are seeing high numbers of non-COVID patients as well as COVID patients within our hospitals. And Douglas Hospital is not immune to that and is having some exceptionally high numbers that they're seeing inside their hospital.
So that speaks to something very important that we want to share with the public that they need to know and should know. Want to elaborate about COVID testing. How is COVID testing going in Douglas County?
So COVID testing is going really well. We have a lot of opportunities to get tested right now. And there's a big demand to get tested. We have that daily testing that's happening in our health departments or outside the health department that you can continue to do that. But then we also have additional testing. So on the 18th, we'll have testing at the Douglas County Police Headquarters Police Department. And on the 19th, it will be at the courthouse that testing will be available. So we continue to ramp up those testing efforts throughout the county.
Gotcha. I also want to thank that the group CORE, because I know CORE is working with you, along with the Air National Guard, with helping, right, with additional testing sites.
Absolutely. This has been a community effort to have to deal with this pandemic.
And it's also a good idea. I think we want to really share that we'll have more information for people who are interested in learning details about testing and additional locations on your website, Cobb and Douglas Public Health.org, and also celebratedouglascounty.com. Dr. Memark, what can you tell us about the COVID-19 vaccine? It's all over the news. It's all over websites with information that it's coming. What can you tell us about the COVID-19 vaccine?
Yeah, so we've been working very hard on vaccine efforts at this time. And so you might have heard yesterday that the first vaccines were administered in Savannah. So we have 9 doses that were administered in Georgia of the new Pfizer COVID vaccine. So we've talked a little bit about the vaccine in the past, that it's an extremely efficacious vaccine, that it works really well. With like about 95% of people, it's able to prevent getting COVID-19. Now, there are some side effects that when you get the vaccine, right? So we talked a little bit about that. You can, within a couple of days, get headaches, fever, muscle aches, but you shouldn't have the respiratory things that you see in getting COVID-19. So our district is working hard with preparations to receive the vaccine as well. So we're really excited about that. We're not quite sure when our shipment will arrive, but it will be in the next few days or within the next week for sure. We'll be getting that vaccine. So what you've heard from the FDA is that it's only been approved thus far for having healthcare personnel to be vaccinated, as well as nursing home residents. So those are the people that will be working with our partners, including WellStar and different physicians, to vaccinate those folks first. But I want everybody to know that the first group of vaccines is a much smaller dose than what we need. All right, so it'll be coming out in allotments, but it won't be as big as we really need in our district.
Wow, thank you so much. We're 1 week away, Christmas. And with Christmas and New Year's right around the corner, what advice can you give to Douglas County residents about staying safe and healthy?
Yeah, so we talked about the vaccine, and so I want to go ahead and add on to that. The vaccine is here, but it will not be available to the mass population for another few months, okay? So, and it's not approved for children under the age of 16. So we're talking that we've got months to go as this pandemic surges on. 728 cases per 100,000 is not a joke. It is an extreme number of cases that we're facing. And so when we go into this, people ask, well, what do we think caused this surge? And we know that there was a national surge that was happening, right? The level of COVID fatigue is very real, and people are not doing the measures as well, preventive measures, as they did previously. And so when then we had cold weather hit, we knew it was going to turn out this way if we didn't do anything different, right? And unfortunately, we just didn't do enough. And so the holiday, Thanksgiving holiday, compounded on top of that. And now we definitely have very, very high rates of transmission within our community. I really implore our community as we go into the Christmas holiday to please, please, we cannot gather during this holiday. Do not gather with folks that are outside of your immediate family. The level and risk of transmission is very, very high for that. And so please, we need to not gather, not even the less than 50, not outside your immediate family. Whenever you're in public, please wear your mask and keep your distance away from folks that are not part of your family. And washing your hands. These are the only ways that we're going to slow this down, to give enough room that we can get enough people vaccinated. Because if we keep going like this right now, we're running out of runway space to be able to take care of our population.
Dr. Memark, I know you sent your newsletter out. Your newsletter was sent this week, I believe just yesterday. And one of the words that caught my attention, which is pretty much what you're stressing, and it's important for the community to be made aware that this is a dire situation right now. Isn't that correct?
Yes, it is. We have talked about this in the past. Remember when we were trying to flatten the curve? You remember that?
Yep.
Well, we've blown past that. Okay. And so we're going to lose more lives, more community, families and friends, if we don't do something to slow this down. We are at hospital capacities. We have a surging virus that is just transmitting throughout our community. We got to use public health measures to be able to slow this down in time to give some vaccines to our folks.
Dr. Memark, is there anything else you would like to tell our residents of Douglas County today?
No, just thank you, everybody. And I really wanted to shout out to our healthcare workers that have been on the front lines from the beginning of this, and our teachers. I mean, really, God bless our teachers that have gone face to face and continue to take care of our children through this pandemic. I really wanted to thank them too.
And, Dr. Memark, along those same lines, something too, I want to give a shout out. I want to give a shout out to our first responders in Douglas County. As the public information officer for the fire department, so often I hear the sirens, I see the trucks, lights flashing, blaring down the street, and I know that they're responding to emergency situations. And I always think of our first responders in that respect. So, I'm just sending a lot of prayers and constant thoughts and cares for our first responders as well.
Absolutely. Thank you.
Dr. Memark, thank you so much for joining us today. I appreciate it. Please have a next day and see you next time.
All right. Be safe.